Hey everyone, I'm Donna, and today I'm going to be talking about colon polyps. So what exactly are they? Colon polyp is where clumps of cell grows on the lining of your colon and the rectum. Polyps may be scattered throughout the colon and vary in size from a few millimeters to several centimeters. Polyps may have a flat or raised appearance. When raised, they can resemble small bumps, called sessile, or even grow on short stalks, called pedunculated, resembling a mushroom or small cauliflower. Here you can see the differences between them. Experts aren't sure what exactly causes colon polyps, but there appears to be a combination of environmental and hereditary factors that leads to their formation. One possible cause may be due to the genetic changes in the cells of the colon lining that affects the normal cell life cycle. It's thought that they're caused by the body producing too many cells in the lining of the bowel. These extra cells then form into a bump, which is the polyp. Colon polyp is actually very common in American adults. It has been found that about 15 to 40% of adults may have colon polyps. Several risk factors are at play. Men and older adults, those 50 and older, are at an increased risk. Family history plays a role too. Those who have family members that have polyps or colorectal cancer, or they themselves have inflammatory bowel disease, are at a higher risk of getting colon polyps. Lifestyle factors such as smoking, drinking a lot of alcohol, and having a diet with low fiber contributes to the development of colon polyps, as well as those who are obese. Most people who have colon polyps don't have symptoms. Usually you can't tell you have it because you feel well. When it causes symptoms, there could be many. You could have bleeding from your rectum or even blood in the actual stool. Blood can make stool look black or can show up as red streaks. Bleeding from polyps can occur slowly over time without visible blood in your stool, but chronic bleeding robs your body of the iron needed to produce hemoglobin. That results in iron deficiency anemia, which can make you feel tired and short of breath. Another symptom is changes in your bowel habit, such as having constipation or diarrhea that lasts longer than a week. Abdominal pain could also result if a large colon polyp partially obstructs your bowel. It's important to have regular screening tests because colon polyps found in the early stages can usually be removed safely and completely. There are many tests currently available to help diagnose colon polyps, but the gold standard test that is currently available is colonoscopy. It's the only test that is able to evaluate the entire colon lining for polyps, as well as take tissue samples and remove any polyps during the same procedure. While there are stool tests available that check for hidden blood or abnormal DNA, which are currently available to help detect cancers of the colon, it is important to realize that they screen for cancer, not polyps. Doctors treat colon polyps by removing them, usually without the need for surgery. In most cases, doctors use special tools during colonoscopy or flexible sigmoidoscopy to remove colon polyps. In both cases, you'll be able to detect irritated and swollen tissue, ulcers, polyps, and cancer. The best treatment for colon polyps is polypectomy. It's painless removal of the polyp with a colonoscope at the time of the colonoscopy. Sometimes the polyp is too large to remove completely in one session, requiring either multiple colonoscopies and possibly surgery to remove it completely. If you have colon polyps, your doctor will ask you to get tested regularly in the future because you have a higher chance of developing more polyps. Call your doctor right away if you experience severe pain in your abdomen, fever, bloody bowel movements that don't get better, bleeding from your anus that doesn't stop, dizziness, or weakness after they remove a colon polyp. Nutritional management includes making healthy lifestyle choices and watching what you eat. You could try to incorporate physical activity into your day as well as not smoking cigarettes or quitting if you do. Avoid drinking excessive amounts of alcohol and losing weight if you're overweight or not gaining weight if you're already at a healthy weight. Changes to your diet may also help, and that includes eating more fruits, vegetables, and other foods with fiber, such as beans and bran cereal, as well as incorporating calcium-rich foods into your diet. You should also limit the consumption of fatty foods such as fried foods, red meat such as beef and pork, and processed meat such as bacon, sausage, hot dog, and lunch meats. The vast majority of polyps are not cancerous or even precancerous. With that said, they have the potential to turn into a cancer over time. Colon and rectal cancer most often begins as polyps. It may be fatal when found in its later stages, so removing the polyp is a way to help prevent that from happening. Thank you for listening.